Hi there, Dr. Manning here from Restore PDX. I hope this video finds you happy, healthy, and sane during these trying times of the coronavirus crisis. I wanted to provide an update of our telemedicine services that I've been performing over the last couple weeks. I had an interesting case that I saw a patient for a new problem. The patient was having severe pain going down the arm with numbness and tingling into some fingers in the hand. Now this patient just woke up with it one day, no apparent cause, but was very concerned about the severity of the pain, but also the fact that the numbness was getting worse. Now through telemedicine, I was able to listen to his symptoms, to perform a evaluation and some sort of a physical exam using the video chat platform. Through that physical exam, it was pretty clear that his symptoms matched up with a problem where he was having a disc herniation in his neck, pinching a nerve that was then causing the symptoms down the arm. From this exam, I, in my initial assessment, had written that I had suspected that he had a C7-T1 disc herniation that was causing left-sided foraminal stenosis and impinging the descending or the C8 nerve root. And sure enough, we used that initial consultation to generate an order to get an MRI of his cervical spine to try to confirm or rule out that possibility as the cause for his symptoms. Luckily, his insurance company had realized that even though it was a telemedicine visit and I had never actually physically examined the patient with my own hands in clinic, that it was indicated to happen, and they approved it. When we got the imaging report, it was very satisfactory to have a congruence. The report had mentioned that there was a new C7-T1 disc herniation that was protruding more on the left side, and that it was impinging that C8 nerve root. So here we have a telemedicine visit where, without a complete in-person physical exam, I was able to generally predict exactly what was probably causing this patient's symptoms. So that's all good and well that we got the MRI and we have the appropriate diagnosis, but the patient is still in severe and worsening pain with neurologic symptoms. So this is a type of situation where we could strongly consider performing an injection here in the clinic to help decrease his pain, hope to keep some of his neurologic function intact and reverse or slow the progression of some of his neurologic symptoms. So in fact, that is what we have chosen to do. We think that it is safe, and we will use strong social distancing and precautions as necessary to actually treat this patient in the clinic. Now, I just wanted to provide an example of some of the things that we can do with telemedicine. Even if it's not acute, severe pain with neurologic compromise that we're treating, but even if it is other issues that are new or old that you'd like to figure out what's going on, I'm pretty confident that via the telemedicine platform, we can still address those issues and get the ball rolling to get an accurate diagnosis, so that if and when we would choose to intervene with some sort of injection therapy, we could do so. Well, I hope that you found this case interesting, and that if you do have any of these problems, that you'd consider calling our front desk or visiting our website to see if you would like to have a telemedicine visit. Thank you.